Hello, this is Laura Norton-Cruz, the director of the Alaska Resilience Initiative. Thank you for the opportunity to present to you. I'm sorry that I can't be there in person. I really wish I could, and I would love to engage in conversation with you all day today. But I cannot miss any of these days of Catalyst, so thanks for letting me present this way. As you know, the Alaska Resilience Initiative is a statewide cross-sector collective impact initiative, and our common agenda or our shared goal is mobilizing Alaska to end child maltreatment, intergenerational and systemic trauma through healing and strategic advocacy. What I'm going to present to you today is our approach, how it is that we came to decide on collective impact and what that means, and what is our structure. And then our scope, kind of what is included when we talk about trauma and resilience, what are our fundamental values that drive this work, kind of how are we approaching this work, and then what it is that we're doing, that we've been doing for the past year and that we're working on now. So as you know, in 2012, Trevor and the Children's Trust was looking at the trauma and resilience work happening around the state and asking questions about how it could be better coordinated and connected. And at the same time, I was working at the Alaska Native Tribal Health Consortium, seeing all over the state the wonderful work that was happening, the ways that tribal health organizations and tribal partners and other folks were engaging, domestic violence shelters, et cetera, were engaging with the trauma and resilience research, and really hoping that there could be a coordinating body to bring us together and a collectively led sort of network, of the folks doing this work to be more effective together. And so when I had the wonderful opportunity to be hired to direct the Alaska Resilience Initiative in early 2016, found my way to collective impact as a way of doing that. And it was really in line, I think, with the way that the Children's Trust had conceived of the project in writing the MARC grant. And so, as a way to bring the collective wisdom and guidance and vision of the folks who had already been doing the work around the state together to be more effective. And so one of the main reasons why collective impact is because it's been shown to be able to create big shifts, population level impacts on complex social problems. And of course, intergenerational trauma is a complex social problem. The idea of is that it can't be led by one organization or one sector alone, but that it has to be led in a cross-sector way. And so in order to really do this in a participatory way, the first thing that we led is a gathering of Alaska Native and Native American trauma experts from around the state to help frame what it is that we mean when we talk about trauma and resilience, what should be included in that frame, how should this be talked about and addressed. And then following that, there was a kickoff meeting where we invited everyone around the state, every organization, tribe, government, put our heads together about how to do this collectively. And so, drawing on the experience and the wisdom of the folks who have been doing this work, some of them for decades, we came up with, we asked them questions like, is Alaska Children's Trust the appropriate backbone agency? What should be our common agenda? What kind of work groups do we need? How to form a steering committee? And from that gathering, a transition team was formed to form the steering committee. And, some initial conversations about those, that then the steering committee, which began in October 2016, was able to take on and create the operational guidelines and decision-making and the work groups and the common agenda and so on. And so the current structure, this is a little sketch I made of it, is that here's Alaska Children's Trust as the backbone, right? The backbone agency does the network coordination. That's a little backbone. I'm the program director. I'm the only full-time staff on there, so I have a full body and a little crown. The other Children's Trust staff, of course, play crucial roles. Trevor, Vicky, and the interns that we get here, all really contribute a lot. And then around me is the steering committee, so the main visioning and guiding body. We have two co-chairs, Liz Medicine Crow and Lisa Wade. And then more recently formed are the 3 work groups, and each work group has a steering committee co-chair and a community-based co-chair. This little amoeba-looking form is the larger network of people involved in the Alaska Resilience Initiative or on the listserv, people who are interested in this, and we're going to be working on formalizing what membership means actually in the next few months. And then there's also these kind of overlapping regional resilience coalitions and overlapping statewide coalitions like Recover Alaska or the Alaska Wellness Coalition. Sorry, I forgot to explain. So as a backbone agency, primarily we're doing the network coordination. We're collaborative hosts, really facilitating this collective process. And what the backbone is in charge of making sure happens is the guiding of visioning and strategy, supporting the alignment of activities, paying attention to what's happening on the ground, and connecting people the way that the Children's Trust does as a convener. I'm a connector. It's also establishing shared measurement practices, working on evaluation. This has been a major focus lately. Really utilizing data and fostering data and making sure that we, are aligned about how to use data. It's about building public will, really being a voice on this topic at a state and even national level. Advancing policy and mobilizing funding, which of course is aligned with those Children's Trust goals or focus areas of being a catalyst, an advocate, and a convener. So next I'm going to talk about our scope, what drives us, what informs us. So what makes the Alaska Resilience Initiative different than other statewide coalitions, for example, is that we're guided by the neurosciences, neurobiology, epigenetics, adverse childhood experiences, and resilience. And by this lens in everything we do, with a child development kind of life course lens. We also understand that this is ancestral knowledge, that in many ways the neurosciences are a translation of the indigenous knowledge of many people throughout the globe. And so we look to those different ways of knowing and different ways of approaching trauma and resilience, of how to foster healthy pregnancies and infancies and childhood and parenting, etc. In order to support approaches to prevent trauma and to help people heal, survive, and thrive after trauma. We, of course, do this with the idea that interventions need to happen at each level of the social ecology in order to be effective. Now, what do we mean when we talk about trauma and resilience? The way that we conceive of it is that we are talking about ACEs, adverse childhood experiences, those intrafamilial traumas, but we're also talking in a larger scope about forms of trauma that affect children's development and affect families. And it is really crucial to partners in the Alaska Resilience Initiative, and this came out of that Alaska Native gathering as well, that we must address cultural and collective forms of trauma, including, especially here in Alaska, the historical and ongoing systemic trauma that has affected Alaska Native people as a result of colonization. But that also includes looking at the historical trauma from slavery, from the Holocaust, the way that war, political violence, and repression, community violence affect children and families. And then also inequities. So we know that lesbian, gay, bisexual, transgender, queer, and questioning youth are at higher risk of being bullied at school, being kicked out of their homes, and therefore experiencing homelessness, being at risk of commercial sexual exploitation because of homelessness. And so these kinds of inequities and the ways that they intersect with ACEs and create risk for youth is something that's really important to attend to. And also that LGBTQ youth might not feel as comfortable going to get behavioral health or health care because they may not be treated well at those places. And so then that further exacerbates the effects of trauma if they can't get help. So these are the kinds of issues that we consider important to look at as well. Or when two children who have been experienced trauma at home go to school and act out, they may receive different responses or different levels of punishment at that school based on their skin color. And research has shown that that the effects of ACEs can be treated differently based on race, leading Black and Native students, more into that prison pipeline, putting them at greater risk of incarceration or homelessness as a result of ACEs. And so we feel that this is really important to look at. There are also inequities in the opportunities for, healthy child development based on income, because we know that that cost is a major barrier to high quality early childhood. And so we consider this kind of inequity an important issue for our work. So what we believe in, is centering equity in this work, doing this ACEs trauma and resilience work in a way that is good for all Alaskans. And it really draws on the leadership and guidance of Alaska Native people. And so Lisa Wade has really been, Lisa Wade and Liz Medicine Crow, our two co-chairs, have been really important in shaping the way that we approach this. And so in May, our steering committee had an all-day meeting to really think through what it is that guides us. What are our values? What are our ethics? How do we want to do this work? And that was very helpful for producing the white paper that you can find on our webpage in the work tab under updates. And I believe you have it in front of you as an articulation of who we are and what we do. And this was to help kind of keep us on track and remind us and keep us focused and help us decide what our priorities are, but also as a template for other regional coalitions to use or other organizations in the lower 48. One of the things that you'll find in this white paper is based on the exercise we did in May as a steering committee about what are our foundational premises, what are the basic beliefs, the human rights that we believe drive this work. What is it that we believe Alaskans deserve, like to live lives of dignity and meaning, for example. And then what are the ethics that we can hold ourselves to in every moment of doing this work, whether it's a meeting or a presentation or community engagement effort or something we're writing. Can we hold ourselves to be authentic and to engage in reciprocal relationships, to be honest and open, to center equity in all that we do, to value diverse voices and perspectives, etc. So this really helped us to focus and set our agenda on the 4 areas of work that we do, which are networking, communication, systems change, and policy. So I'll begin by talking about networking, because this is perhaps the most fundamental thing we do. We were formed to be able to connect the people across the state who are doing this work so that they are able to know what each other is doing, to be able to better share resources and tools, to not duplicate efforts, to be able to coordinate in order to be more effective. Early on, the national evaluators helped us do some kind of system mapping. And we see that there is a lot of collaboration between sectors, but we also know that there are major changes that need to happen through improved collaboration. And so in order to support collaboration and communication across the state, we created an email list, so that now has 350 people on it, a social media presence where we can share articles and events and tools and resources for folks, a group on acesconnection.com, and then most importantly, a website. This was really the project for creating a hub for sharing resources and tools and allowing people to connect. And so we have an interactive calendar where people can submit events and come and find out about events happening around the state that address trauma and resilience, where we have multiple sections for resources, background, tools, and people lately have been submitting resources that they want added to this website. So it really is working as a hub, as well as it's a place to direct people for one-stop shop for information. It's a way, the website serves as a way to showcase our community partners, which both, gives information, but also allows people to connect. So if a region or a community wants to start their own coalition, they can find out who to connect to get more information about how to do that. And that is one of our major goals, is that people can do this work on a local level. So we support the ongoing development of our strong regional coalitions like Southern Kenai Peninsula Resilience Coalition, Raising Our Children with Kindness Mat-Su, or Rock Mat-Su, and Rock Juneau, but also more burgeoning coalitions like Ketchikan, and lately I've been working with Fairbanks to get one started. So it's been exciting. In our communications work group, what we've been taking on is mainly curriculum. So one of the major recommendations from that May gathering was that the curriculum that would be built to replace ACE interface would address cultural and collective trauma and kind of a social justice lens. And so we have dozens of trainers trained beginning in 2014 in ACE interface, and then there was a second cohort trained in 2016. And they have been able to meet a lot of training needs, but the ACE interface trainers, as well as others, have identified the need for an Alaska-based curriculum. So we will be having an all-day curriculum building session on September 25th with the idea that there will be kind of a core curriculum with supplemental packs for different audiences, healthcare, education, early childhood, parents, etc. And a lot of this, we've been developing over the past year and a half. So it's just about using our collective wisdom to come together and say, what is the most effective way to present this and how to modify it for different audiences. So the plan is to spend the fall doing that and do a training of trainers, hopefully in February. We'll also be working with Dr. Linda Chamberlain to incorporate some mind-body healing modalities in there. And we have a few different scientific advisors and support from the DHSS public information team to do some of the graphic design, which is really exciting. Southern Kenai Peninsula has been taking on more of like a public communications campaign. So they've been testing messages with different groups of people who interact with children, with young children. And so they have a communications plan and toolkit that they've been deploying and testing, and we'll continue to work on this. And then we'll be sharing that toolkit as they have it ready for deployment. Our blog is another way of getting out communications messages, positive stories and tools that are available in Alaska. Ann Hillman at Alaska Public Media has been doing really great reporting on solutions to social problems. And so we, have been sharing hers, including reporting on the child protection team in Quingilinguk. And this gentleman, Johnny Friend, is on one of our work groups. We really want to highlight the ways that, the creative ways that Alaskans are addressing these issues and coming up with solutions through our communications channels. Systems change. So our trauma-informed systems change work group is based, and a lot of the work that we present in the communications as well, is about moving towards trauma-informed schools, healthcare, etc., which means safety, trustworthiness, choice, collaboration, empowerment, and equity. And so another way of looking at it is that trauma-informed schools or other institutions are about interrupting this cycle that so often happens, that a child is punished for the effects of ACEs and therefore re-traumatized through that punishment, which increases their stigma and risk. And so it's about doing the opposite of this. Instead, having those institutions be places of healing that support children and families. And what we understand is that this needs to be not only trauma-informed, but culturally responsive so that it works for all children. And that's the approach we're taking in the work we're doing, with the Anchorage School District. So we're working directly with the Anchorage School District. Marcus Wilson, of course, is leading this effort and inviting us in with the elementary division. So I trained all of the elementary school principals, and we will be doing a training in partnership with Josh Arvidsson, who's also on our steering committee, to all of the elementary division staff, and then continuing to support the principals and teachers after that. So that's a great project. And Anchorage School District, like many school districts in Alaska, already has some principals who have taken the lead on this. And luckily, 2 of them are joining our trauma-informed system change work group to help guide this work. On a regional level, there have been a trauma-informed learning cohort in both the Southern Kenai Peninsula and Mat-Su working together so that their tribes, schools, hospitals, social service organizations, early childhood organizations are, coming up with specific change strategies and sharing those ideas with each other. And this is getting the idea is to elevate those solutions statewide, and some of them are even getting national attention, including some of the school efforts in the MATSU. And the system change efforts. In the MATSU, they're working with Office of Children's Services for some really, really creative kind of system and policy issues, as well as working on a safe baby court. In Rock Juneau, they're doing some policy advocacy around sales tax money to support early childhood. And long term, there are many ways we could go with this, including system change efforts in healthcare, which is an area I'd like to move into. But in order to be effective right now, we're really focusing on schools because there is so much interest in this and we can provide something. So our trauma-informed system change work group is focusing on schools right now. Lastly, our policy work. So this is a picture from our all-day gathering of the policy work group in June. We've done some policy advocacy, during session, during winter and spring to support, federal health care and federal trauma-informed legislation. And we helped revise, worked with Representative Guarantar on her House Concurrent Resolution 2 and helped submit some revisions to really strengthen the bill. It did not pass this session, but it's something that, we can move forward on next session. So we've done some policy advocacy, but what we've mainly been focusing on this summer is creating a process for decision-making around policy so that we can be really thoughtful and careful and effective in what we do. And so what we came up with was an advocacy guidelines document, which includes this matrix for decision making. And so there's some initial screening questions to determine whether we should even move forward with the policy at all. And then a pretty comprehensive, rigorous, kind of mathematical approach to looking at alignment. Is it evidence-based? Is there sustainability? Is there input from other groups, including a comprehensive risk and drawback assessment that asks about, would this damage the Alaska Children's Trust, funders, etc. And so the steering committee has approved this process so that the policy work group can move ahead on policy changes. And there's a system for notifying the steering committee and the Alaska Children's Trust of any policy work that we do. And I think that we've spent a lot of time also trying to disentangle our policy work and Voices for Alaska's Children so that we're not duplicating each other's efforts. And I'm optimistic that we are able to do really complementary and coordinated work with one another. And I'm excited to move forward on that. So thank you. If you have any questions, please do not hesitate to call, text, or email. I'm happy to answer. Again, sorry I can't be there, but thank you for your time.